Welcome to the Pawsome Companion, where pets are part of our family. I'm your host, Joanna Herrera, the founder of Coco and Bone Diet. I'm very excited to interview experts and pet owners to share their stories and insights so you can use them to take care of your babies. Hello everyone, welcome to the new episode of the Pawsome Companion. I'm glad to have you here, Alex.
Thank you very much.
So Alex Hibbert, Alex is an emergency vet based in Adelaide, and after graduating from the University of Adelaide in 2016, he worked as a mixed vet in Jazz before returning to Adelaide and transitioned into emergency medicine 5 years ago and has been with SASH for almost 3 years, specializing in cardiac disease and fluid therapy. Alex worked for SASH, helping in medicine, surgery, and critical care, and is passionate about animals and taking care of illnesses and all around it.
Definitely.
So welcome to the show, and please explain a little bit more about what you do.
Yeah, thank you. Well, thank you first for having me. So obviously I'm an emergency vet, so I'm one of many emergency vets we have. We sort of have, I think, 8 full-time emergency vets and numerous part-time casual emergency vets, but we provide a 24-hour service for animals that are critically ill or injured at any time of day or night, and we're sort of the first line treatment for those pets. When you can't get into your general practice, or if something happens at midnight, we're going to be that sort of port of call as an emergency vet.
Yeah.
We don't see any sort of, routine things. We won't see.
It's always something coming up, different.
Always something unwell. We're not going to see you for your puppy vaccination and that sort of thing. It's always very different or extreme or unwell is sort of what we do.
Yeah. So you said that you have been with SASH for almost 3 years.
Mm-hmm.
SASH is fairly new. Started 3 years and a half ago.
Yep, in Adelaide, fairly new. So SASH there's a couple of us now around the place, but started in Sydney a number of years ago. I'm not actually 100% sure how long it started in Sydney, but they opened the Adelaide branch 3.5 years ago. Yeah.
Okay.
Yep.
So SASH is located in Sydney, Adelaide,
and
Queensland.
then Queensland.
That's it.
So there's 5 branches in Sydney, in New South Wales.
Yeah.
Going from sort of the Central Coast, and then another 4 sort of through the local region in sort of Sydney. And there's 2 new ones in Queensland on the Gold Coast and the Sunshine Coast, and then we're the Adelaide one. Yeah.
Amazing.
Yeah.
So you transitioned from being a vet, like a regular vet, right? To being an emergency one.
Yeah.
What is the difference between those two?
Yeah. So your general practice vet. So I guess everybody starts off probably as a general practice vet. You sort of graduate uni and you generally transition into that, and their main protocol is to do routine health care, preventative health care, and fix sort of the initial unwell presentations. And I guess we at SASH work with your general practice as well.
Okay.
So we're not sort of a competing business. We're sort of it's like a whole hospital sort of system essentially. So when something gets very complicated, they send off to our specialty referral sort of service where we have specialists, internal medicine specialists, we have sort of specialist surgeons, we have dermatologists, neurologists, radiologists, all the ologists, and they sort of make up the referral part of our hospital. And then we have emergency vets who are general practitioners who've sort of moved into just doing emergency work. A lot of us have extra qualifications. So I myself have sort of a members in emergency and critical care medicine.
Or some of them probably have a specific illnesses. Like, is that relevant, or how does it work?
So I guess obviously SASH is sort of split up into the 2 sort of businesses in a way. So we sort of have our specialist and referral centre who are our ologists, so our dermatologist surgeons and that. And then there's sort of the 24/7 emergency clinicians.
Which is where you are at.
Yeah, so I'm sort of part of that team, but we do all sort of work together.
Okay.
So whenever an animal presents at SASH, they do get they initially will often present, say, at midnight we stabilize them. And what we probably, focus mostly on is the stabilization and initial management of those patients. Say if an animal is, I guess, in a motor vehicle accident or something like that, something traumatic happens, they present on the door. We're the people on the ground who will get them fluids, pain relief, talk to the owner initially, try and figure out what's going on and keep those patients comfortable and stable. And then from there, by the time it comes to the morning, we usually present all these cases to the entire hospital.
Yeah, okay.
And then the different subsections will help us take over. So our surgeons will, help us, and our radiologists will put them, through a CT scanner, figure out what's broken, and the surgeons can fix that part. We have our critical care specialists who take them into sort of like an intensive care unit type thing, like in a human hospital, and they'll manage them for however long it takes to get them better again.
Okay.
Yeah. So it's sort of a whole hospital approach, I guess.
Yeah. So, like, what are the sort of the most receiving cases? I know that you're saying there are so many things that you cover in this hospital, but what are the cases that are more regular?
Yeah. So I guess as an emergency vet, probably the most common things we'll see are patients that sort of things happen acutely overnight. So say you're vomiting and diarrhea that pops up is probably like a really common thing. Acute lamenesses, so a dog sort of starts becoming really sore on their back leg or something like that. And then, to be honest, a lot of the sort of more traumatic things, so motor vehicle accidents, I guess complications of other diseases as well. So, say if a patient has something like diabetes, it progresses, those patients can become really unwell and often they'll get transferred to us. But we do work with, your general practice vets who, often they are the ones who maybe diagnose the initial condition as well. So they'll see a patient, last thing on a Friday night or something like that, and they're not open Saturday, but the patient is too unwell to go home. They'll transfer the patient to us and we will continue management and ongoing workup of those hospitalized patients, I guess.
And when they are hospitalized, it depends of the time that they stay there, it depends of the recuperation and the time that they take to get better.
Yeah, exactly right. So it's really, it's one of those really tricky ones because all of those things are a bit unknown sometimes when you first get a patient, and depending on what the condition is. So, say a patient comes in with a complicated diabetes, it's a management of getting their glucose levels down, getting their vomiting and sickness under control, and sometimes that takes 2, 3, 4 days, maybe a week. We've had patients in for 3, 4 weeks at a time, depending on conditions.
Yeah, absolutely. I think this is very interesting because I'm from Colombia, and in our country, the medicine around dogs and pets and cats is not as let's say in a hospital for animals. No, it's only going to a normal vet, which is the one who does everything. But it's amazing to be able to have a place where you can take your dogs and cats and animals and get them, well treated and with good care.
Definitely.
People that specialize on those particular emergency cases. Which is something that.
And I think sort of the animal healthcare industry has really shifted in the last sort of 10 to 20 years, where, back 20 years ago, there wasn't these options for sort of ongoing 24/7 care, and often your general practice did do that sort of thing. So they would keep patients overnight, and maybe the vet would come in at midnight and have a look at the patient, but then that patient might be left alone on a drip and that sort of thing. Whereas now we have dedicated staff members who are looking after patients sort of all night.
Absolutely.
So nurses and vets all night,
which is great. I feel like this is something that obviously every pet owner, because some of them have dogs as their kids, and they want to have 24/7 care when there is a big complication on animals. So what sort of animals do you get there? Any which range of animals?
So we're small animals mostly. So primarily dogs and cats.
Okay.
In Adelaide, we don't have an exotics department yet, but in Sydney there is sort of an exotics department in the SASH hospitals as well. So they'll see birds and frogs and
amazing.
All those sort of weird and wonderful type creatures, I guess. We do, on an emergency basis, still see rabbits, birds, I've treated a couple of frogs now as well.
I didn't know that people have frogs.
Yeah, little pet frogs. They live quite a long time as well. My favourite frog, I think, was I've forgotten its name. I think it was Princess, the frog.
But you had a frog before?
I treated a frog before. I haven't had a frog personally. No. Yeah, but there are a few floating around.
Okay, that's weird. But yeah. So you were telling me that you got a cat and a dog.
Yes. So I got a dog named Floyd. He's a 7-year-old blue heeler cross. And then a little ginger domestic short-haired cat called Gimli, who's a bit of a terror, to be honest.
So do you have any fun stories from them?
Probably too many. I think
you were telling me a few of them, which are like funny.
I mean, my dog, his favorite thing is rolling in dust. To be honest, he digs up little holes in the ground and he has a dust bath every day, which is very frustrating after giving him a bath.
So you have to wash the dog very often.
Yeah, or I give up and don't wash him probably far enough. And then my cat just loves to talk, so he just meows at everybody and everything all day, to the point where we found him talking at the dog independently of us. So,
oh my God, that's quite cute.
It's very cute. A bit annoying.
You're like, oh, what are you saying now? Oh gosh. So it's great that they have a person that is taking care of them if something happens.
I mean, hopefully they feel that way. I don't know. Maybe it means we over-examine them a bit too much. My partner's also a vet, which so she's a specialist actually. She's a pathologist. So she's done another 4 years of sort of study to become a pathologist. But it means we have some. We're probably over the top pet parents. If something goes wrong, it's. Very
but
detailed.
Do you have kids or not yet?
No kids, no.
Okay. So can you explain a little bit about that pathologist,
Or the sort of specialising?
What's that?
So the specialty process, so after you do your sort of 6 years at university and become a vet, there are vets who go on and do specialties, which is how our sort of specialty and referral service works. So they often will go through an internship for a year or two, depends on how long it takes them to then get a placement in a residency. And then they'll do, a 3 to 4 year residency program and sit multiple exams often through that process. And then they finally will sit sort of a set of exams. And if they pass that, they are a sort of specialist veterinarian. So they're fellowed, I think is sort of the term, or boarded specialists. So those are the people that we have. So our internal medicine specialists, our surgical specialists, dermatology, radiology, neurology are all sort of the specialty departments that we have in Adelaide, who are all a number of vets who have done that sort of additional training in that specific area. So if something sort of goes very wrong and it's quite complicated, they're the people that I would definitely want looking after my pet.
Yes, absolutely. And it's very important to see that there are so many different areas that specialize in different aspects when a dog is suffering of illness. Yeah. So do you treat cancer as well in SASH?
Yeah. So at the moment, we don't have an oncologist, although I think that's a little bit of watch this space at the moment. I think there might be some news later in the year about that. But our internal medicine specialists do a lot of oncology work at the moment, and have been doing that sort of work in Adelaide for quite a number of years. But there are oncologists as well.
Okay, that's great. So from now on, if someone is looking for any referring, so how do you work with organizations that are RSPCA, people those who are focusing on the adopting pets and all of that? Do you work with those associations?
Yeah,
in parallel with them, or
no? I guess with the welfare, we work quite closely with the RSPCA and the Animal Welfare League in South Australia as well in regards to helping them with fostered animals. They have a lot of fostered animals around the place. Yes. If those patients get unwell overnight, then we will sort of help them manage those patients overnight and get them back to their dedicated veterinarians, I guess, because the RSPCA has their own veterinarians, and I think the Animal Welfare League does as well.
Okay.
I guess in regards to sort of how we work with, say if your pet got sick or a lump popped up or something like that, you would generally start with going to your general practitioner.
Yeah.
And from there, if your general practitioner thinks it's a complicated case that would benefit from referral to some of our specialty team, then they would refer you on to our hospital, whether it's to see surgery to get something removed or radiology to get some imaging done.
Yeah, I think in this case it will be more about sharing with them content that could be useful for those who adopt animals, and we need to take care of their animals just in case if something occurs.
Yeah,
they go to such.
Yeah, so if you adopt an animal and something was to go wrong, we definitely especially at any time of the day, we can see your pet. Yeah,
I didn't know that such exists before.
Sure, yeah.
So I thought that it was amazing to have a hospital that is specializing in critical things for animals. And so is there any things that you could share in terms of numbers of increase of pets that are attending during peak hours or it varies a lot?
I mean, that's a really good question. I mean, when we look at some of our numbers, we do have sort of heat maps of when animals present and that sort of thing. And from about sort of 8 p.m. till about 1 a.m. We have really high numbers of presentations to animals, especially on, I think it's Thursday nights for some reason. I don't know why. But any night of the week where,
I think it's probably busy, because the beds, the regular beds are closed. So they need to go to where it's open.
And it's when people get home from work and that sort of thing as well, and they might find that their animals vomited or something like that in the house throughout the day, and so they present to us at sort of 9 o'clock at night. Yeah.
And I know that SASH is in 3 different states. Is there any things coming up for other states, or those are the focus states that they want to be on?
In overall, all of our SASHs have a specialty service and a 24/7 emergency hospital. So all of our SASH hospitals are open for emergencies at all times of day. And our referral services are always there. And again, we still work as a big hospital. I guess the differences are what specialties are available in some of the different states, but all of our specialty hospitals have the sort of surgery, internal medicine and radiology available, which means we can sort of cover, and critical care, which means that we can take care of those really critical patients, but also perform, I guess, probably the most common referrals are for internal medicine and surgery.
Yeah, okay. So it means that what are the plans for SASH? I know that you were focusing on probably bring more doctors around cancer treatments and all of that. So is there anything in particular that you see in the market that is growing and is in need and you don't have at the moment?
I mean, in Adelaide specifically, Adelaide, I think, has had low specialist numbers in the state for quite a period of time. If you compare us to sort of other states, we don't have as many specialists. And that's probably a number of reasons for that. But I think SASH overall is trying to increase those numbers to increase what's available for pet owners. And we are wanting to, definitely add specialties. It's just about trying to get the specialists into the state, I guess, a little bit. But oncology is definitely on the horizon. So for cancer, ophthalmology would be something we'd be wanting to get as well. And, the dream would soon, be to get things like cardiology and anesthesia, I guess, available as well.
Yeah, that's great. So in Adelaide, we got only one clinic. Is that right?
One SASH.
One SASH.
Yeah. So there are other emergency, places. That landscape has been changing a little bit, I think, in Adelaide recently. There was the Anzac Highway Clinic that had been open for a long time that's just recently closed. And but we've been that key one. We would, I think, the dreams, I believe, of Sash would be to open up another one in Adelaide. A long way down the track, though. Want to make sure this hospital's
they're available. And if there is any particular practitioner that is not in Adelaide, but we got, for example, a dog or an animal that is requiring those services, what is the process there? Do you transfer the animal to another state, or the doctor comes here, or is there any sort of things that? So
we have done a couple of things like that. So there are, so for cardiology, I think is probably the big one. We can do some sort of minimally invasive procedures with a cardiologist available. And we've sort of flown cardiologists in to do those procedures, which is really exciting. And then other things like radiation oncology. So like in humans, radiation for certain tumor types, we've sort of sent owners over to our sister clinics in Sash in Sydney, and they've had radiation therapy for a couple of patients as well. So those options are always available.
I don't know if you probably this question regards AI. Has AI impacted the business in some regard? Like, because I know that the medicine now is evolving, and now doctors that are in other states or in other locations are able to see the patients and treat them and things like that. Is there anything like that is? Has been like any? I don't know.
The big thing at the moment is how we're writing our notes. Probably just trying to speed up that process. I think that's probably the one that's impacting me the most anyway. I haven't necessarily seen it so much in regards to sort of our diagnosis and management of patients clinically yet, but I'm sure that's something to keep an eye on. But it's definitely improving efficiency with note taking and note writing. If you can use AI, it seems to be really speeding up that process, which means we can see more patients, which is great. You're not spending as much time on paperwork.
So you said that you have been working in this industry for 6 years, right? So how do you feel like the progression? Like, is any plans that you have in the future, or what how do you see yourself? Because your wife is as well a vet.
Yes.
So what are the plans like?
That's a really good question. I don't know. That is a good question.
Maybe I'd reserve for that.
I see myself working for Sash for a while. I think they're a great business, and I think their aim has always been patient focused and also, improving care focus. They really seem to be doing a great job, I guess, in regards to, it doesn't feel, I guess there are lots of practice. I've worked at a number of practices as well. And the veterinary industry is a tricky one because it is it's a small business, I guess, and there's always money involved in all these conversations we have. At Sash, there's no commission basis for any of our sort of work, which some practices work on. So if you see an animal, you get a commission of how much you see, but Sash has never been like that. So it doesn't feel like it's a money or profit-driven type thing. It's all being animal-focused and medicine-focused, which is really exciting. It's nice to feel part of, doing the best for the patients and for their owners as well.
Yeah, absolutely. And what drives you to work from a normal veterinarian to be in an emergency room? Do you feel like you want to be all the time?
I think it's probably the adrenaline rush of it all, and you do feel like you are. I think it's what I dreamed of when I was little, is treating unwell animals. When when I did general practice, sometimes it could feel a little bit repetitive, and that's a me thing. Some veterinarians really enjoy that, whereas every case that sort of presents to you in emergency is difficult and challenging, and you're always generally meeting the client for the first time. So there's always trying to manage the relationship with a client straight away, which makes it I think an interesting industry. And you do get to look after patients for, when they are hospitalised, a number of days, and you get to see some really good outcomes when we've done a good job, which is
imagine those cute animals all around.
And we've dealt with, we've had some really great patients and some really great cases. One of my favourite ones is we had a police dog come in. He got transferred from his referring vet because they'd noticed that he was unwell, and it was a late at night or, one of their last consults of the day. So he got transferred to us and we diagnosed him with a septic abdomen is what we would call it. So he essentially had pus in his abdomen, which is very, very bad, really, really bad.
Very bad, yeah.
And we managed to stabilize him. So I was sort of the frontline vet on the ground who, improved his blood pressure, gave him a lot of medications, pain relief, and got him ready for surgery. He then had surgery really quickly. We called in surgeons overnight. We can get our specialists in who did a surgery and actually pulled out a big mass, which a grass seed was in the middle of. So he probably ingested a grass seed and it had moved out of his intestines and into his abdomen.
God.
So really, really freak sort of thing to happen.
And weird.
Really, really weird. But we managed to do that. And then he spent the next week and a half in hospital recovering from that because there was complications and stuff for him, his procedure. Yeah. I think he actually had to have a repeat surgery at some stage because there was some extra bleeding. But he made a full recovery and I'm pretty sure he's now back working in the police force, which is really exciting.
Probably this could be a silly question, but how do you take care of the animals after they're in a surgery or something like that? Do you have separate rooms for them or bed? I don't imagine that. Yeah.
So generally it's I
imagine the beds, the dogs.
I'd love to walk you through our critical care unit. Mostly we work off, thankfully our patients are a little bit smaller than humans are. So they generally will fit in some sort of a crate. We have a big crib as well. So almost a huge padded baby crib for really critical patients or patients that are on things like ventilators and stuff like that. But mostly we work out of some sort of a crate type system with some nice bedding, and they're all individual, and all our cages set up so patients can't look at each other as well, because we know that stresses out.
This is not good for them to look at
not when they're recovering and they're unwell. Generally them having a look at other dogs and seeing eye to eye isn't ideal, so we try to avoid that as much as possible, and that way they feel like they've got their own individual care. And then there's nurses and vets who'll be looking after them around the clock, essentially managing their medications and their monitoring and keeping an eye on them and communicating with the owners as well multiple times a day.
Yeah, I imagine as pet owners will be calling all the time, how is my baby? Can you please send me a photo?
Well, and we send photos. The nurses are great photo takers of the pets, and they'll send photos a couple of times a day. And the brilliant thing about being 24/7 is if you wake up in the middle of the night and you just want an update, you're allowed to call, and one of the vets or the nurses will get on the phone and give you an update about how your pet's going. Yeah.
So just to let you know, for example, if you leave your pet there, they get into emergency room and all of that, the people can stay outside in a waiting room or something?
So we have a waiting room out there. I guess it's one of those tricky things. We have had people wait in the waiting room. Often if patients are there for multiple days, we do recommend they head home at some stage. But they can come in for visiting and that sort of thing. And we'll have, we have visiting hours and stuff through the day, multiple times a day as well. We try and, manage that a little bit just because sometimes we want to be doing procedures on patients, and there's often a lot of patients as well in the hospital. So it's about managing all those visits and the owners and that sort of thing. But people are definitely allowed access to their pets while they're with us.
It's important for many people, and but at the same time, it's good for them to take rest while they're animals.
And, I think it's good for the animals to see their parent as well and know they haven't been left with a bunch of strangers.
Yeah, absolutely. So thank you, Alex, for sharing all this with us. It has been very insightful, and I know that some of our listeners will appreciate this episode because they will learn a little bit more of how they can probably have a particular entity that can support in these emergency cases. And in terms of vets and practitioners, it's good to consider this option if they haven't, which I think
all of the vets in Adelaide are hopefully in tune with us, and we go out and see them all the time and touch base with them, and
Anyway, your website is sash.com.au?
Sash.com.au, yes, I think so. That's a really good question. So
if anyone wants to know a little bit more or search a little bit more, I'm sure there will be the information there. And Hopefully
Yeah.
no one's have to go there.
Hopefully not too soon, yeah.
Yes. So yeah, thank you so much for coming, and we love to have you here today. Thank you.
Not a problem. Thank you very much.
Thank you so much for tuning into this episode of the Pawsome Companion. If you have any further questions for our experts, feel free to leave them in the show notes or reach out to me directly. And if you are a pet expert who would love to contribute to this podcast, we will be thrilled to hear from you. Don't forget to follow us, and if you enjoyed today's episode, we will really appreciate a 5-star review. Thanks again, and we will see you at the next episode.